Low vitamin B12 is not a direct cause of thyroid disease, but the two are strongly linked. Experts explain how B12 deficiency can worsen hypothyroidism symptoms and how treatment can help. Though there is no real cause and effect relationship per se, i.e., low B12 leading to thyroid problems, a strong association exists, especially with hypothyroidism and autoimmune diseases of the thyroid, such as Hashimoto thyroiditis. In this article, Dr. Arun Campbell, consultant physician, Wanawire Ruby Hall Clinic, Pune, interpret this association as a possible vicious cycle. Hypothyroidism has been studied in association with vitamin B12 deficiency, which exhibits high prevalence in individuals with hypothyroidism. This is because Hashimoto's thyroiditis has a similar autoimmune process that may also cause pernicious anemia, which interferes with the body's ability to absorb B12 found in food. Low B12 can aggravate the symptoms of hypothyroidism. Most symptoms are similar, e.g., fatigue, weakness, and neurological problems. An individual with low-acting thyroid and little B12 can have worse or more sustained symptoms. Low levels of B12 may affect the production and regulation of thyroid hormones. The main reason why the link is not identified more often is that the symptoms of the two disorders are quite similar. An individual who develops such symptoms can be labeled to have a problem in the thyroid, and yet the B12 deficiency is still there, causing more anguish. Endocrinologists also underscore that, in patients with hypothyroidism, and particularly with an autoimmune component, it is also essential to test for a vitamin B12 deficiency. When a deficiency is encountered, it can be treated and observed to such an extent that symptoms can largely be reduced and overall well-being can be significantly improved. Testing is essential. A basic thyroid test TSH, T3, T4 must be accompanied by tests of vitamin B12 levels, in case the patient has persistent fatigue or symptoms that remind them of neurological dysfunction, even though Husha is under thyroid medication. Treatment. Although treatment of thyroid diseases is through the reintroduction of the hormone with medication, e.g. levothyroxine, B12 deficiency is treated with supplements or injection. Individuals with pernicious anemia commonly need to be treated with injections because the intestines are unable to absorb B12 when taken orally. Importance of food. Although supplements may be needed, eating foods that have B12 present in them is also advisable. Good sources are meat, dairy, eggs, and fortified cereals. To sum it up, although low vitamin B12 is perhaps not the specific cause of thyroid malady, it is a frequent comorbidity that can have drastic negative effects on patient symptoms and quality of life. Along with treatment of the condition, an endocrinologist may also check to ensure such a deficiency does not exist to achieve the most effective results in the treatment process. Disclaimer. Tips and suggestions mentioned in the article are for general information purposes only and should not be construed as professional medical advice. Always consult your doctor or a dietitian before starting any fitness program or making any change.